Hello, everybody, and welcome to the show. I want to say thank you for supporting my channel. If you're watching us on YouTube, please like and subscribe. Share with your friends if you like us, and if you're listening on the podcast platforms, thank you again. And today we're going to be doing a 3-part series on bipolar disorder. I have a woman here with me today, and to protect her privacy, we're just going to call her Jane. And she suffers from bipolar disorder, the depression side of bipolar. And in the next interview, I'm going to be talking to a man who also suffers from bipolar, but he had a pretty major manic episode, and it's a very wild story that he has to tell. And then I want to talk to someone about the support system of someone who, family and friends that are around people with bipolar disorder, and what they have to do to kind of just to be there for them, and how that all works. So without further ado, we're just going to get right into it. Hello, Jane. Thank you for thank you for being on the show. So you've lived with bipolar most of your adult life,
Right.
correct?
Yes.
And when you were younger, how were you feeling when you decided to go maybe talk to a doctor, or before you were actually diagnosed?
Well, I did okay in high school, but college was kind of a wreck for me. I was overwhelmed. I was anxious. I just wasn't functioning very well. I was sleeping a lot. And so I went to just a family practice doctor and expressed my concerns and my behaviors. And he diagnosed me with depression and put me on Prozac.
And that was just the Prozac?
Yep.
So did your family recognize that you were feeling low and depressed?
They knew I was having a really hard time.
Okay. So, and they obviously they were concerned about you, and they helped you out and got you to the doctor. And were they supportive of what was going on with you, or were they just kind of wanting you to just feel better, you'll be fine, kind of thing?
No, they were very supportive. And mental illness runs in my family, so it wasn't uncommon for them to know somebody who has mental illness, and they supported the idea of mental illness. So
okay.
it was fine.
Who's this little guy?
This is Carlos.
Carlos. He's probably a pretty good support system too.
He's the best support.
So you were diagnosed with depression, and then you said you went to college, and then at what point were you actually diagnosed with bipolar disorder?
I kind of fell apart when I was getting divorced. My behavior changed, and I was continuously going to the doctor for depression on a regular basis. I don't know, once every 6 months or so, I would check in with my doctor. And I had started having some other behavioral changes, and they changed my diagnosis from depression to bipolar.
Okay. Now, it must have been pretty hard for you to get through college being depressed all the time, wasn't it?
I didn't get through it. Yes.
Oh, you didn't make it all the way through?
No.
So you didn't get a degree or anything?
No.
So how long did you last in college then?
About 9 months.
Oh, really? And you said you had friends that were around you, though? Did they recognize that you were feeling depressed, or did they have concerns about you, or did you just kind of have a pretty good, face when you were in front of them? Because I know a lot of kids today, they really don't look like they're depressed, but then they go kind of hide, and in their own privacy, they're depressed.
Well, my roommate was my cousin, and she has pretty severe mental illness. We didn't know it then, but her behavior was pretty erratic. So I don't think that she paid too much attention to my behavior because she was doing her own thing. And then I just didn't see my roommates very often. They were in and out, doing our own thing. So no, I don't think that I would say that anybody really noticed except for me, and then on the phone to my parents.
So your cousin, it's obviously runs in the family pretty closely. So your cousin was kind of on the opposite side, like more manic than.
She had a lot of manic episodes. She was pretty manic. I would say the most part of why I was there in college.
So did she know that then, or did I mean, I don't know if you know any of her medical history, but when was she diagnosed? Or
I don't think that she was. I know she wasn't taking any medication, so I don't think that she had been diagnosed. I I think that's when her problems started quite a bit. Also, she just, man, she was hard. It was hard to live with her.
okay. Yeah, well, I mean, I imagine it would be hard with like two ends of the spectrum there being
Right.
living together. So you had you're depressed and she's manic, and so she's probably wanting to go out and do stuff all the time, and you're just like, not feeling good and wanting to stay in and whatever.
And she was doing some pretty erratic behavior. She stole a lot, quite a few things: hamsters, meat,
Hamsters.
dresses, clothing.
Okay. So that was probably like just kind of like a kleptomaniac, like just stealing it to steal it, right?
Yes, she stole everything. I think for the thrill.
Right.
She stayed at jail overnight. And I felt like I couldn't talk to anybody about that. I didn't want my mom to know because I didn't want her to talk with her sister about it. I didn't want to feel like I was tattling on my cousin. So I internalized all of that. I didn't know how to deal with any of that. But I kept it inside, and it just created a lot. Not that she was responsible for my mood disorder, but it just created a lot of anxiety and just confusion, and I didn't really know how to cope with that part. I had a couple other crazy roommate situations, so it just kind of compoundly put me into a depressive state.
So when you say depressive state, like a lot of people that don't have bipolar disorder, bipolar depression, everybody's felt depressed at some time, right? So we feel it in a situational thing, like you say someone that's close to you dies, or you lose an important job or something like that, and you get a little depressed and down about it. But with the bipolar, how it just comes and goes without having to have a situation to relate with it. How does it feel being depressed with no reason? I mean, am I putting that the right way? I mean,
Yeah. Yeah, there isn't really a reason. It's just because my brain isn't functioning like it should. So that is the reason why I'm depressed. My brain doesn't make what it needs to make in order to feel normal and happy and have a regular energy level and function like normal people do. So when people ask me, how are you feeling? And I tell them I'm not doing very well, and they say, why not? What are you depressed about? I don't have an answer for that. Because it isn't situational. It's not, I can't blame it on having a flat tire or having a death in the family or financial issues. I can't blame it on any of those things. It's just how I feel. And I never know how I'm going to wake up in the morning. I go to bed fine.
right.
And then I just never know if I'm going to wake up and have a good day or if I'm going to wake up and have a bad day, which is kind of uneasy. And, I've got things to do and things to take care of. And just to wonder if I'm going to be in bed the next day or if I'm actually going to be able to function is kind of tricky. It's hard.
Right. So, I imagine that must be pretty hard. Now, is it something you can kind of feel coming on, like maybe the day before, or... like with other diseases, because bipolar is a disease. If you're having some kind of symptom, you kind of feel it coming on before it actually is kind of a full blown thing.
I do. That's what I can feel in the morning when I get up to try to function. I can tell if I'm going to have a bad time or if I'm going to be okay. And I'm pretty in tune with what my body signals are. Because if it goes on too long, then I know I need to get to my doctor. But my first part is no energy and no drive. I kind of try to relate it to people like having the flu 4 days after, because you're weak and you can't do anything. You're not throwing up or having a fever or anything. So I don't feel physically sick. It's just the mental, emotional part that's hard. It's the getting going, even getting dressed sometimes feels like it's just too much. I just can't handle it. I just can't do it.
Right. So that's, I mean, I imagine that would be pretty hard to hold down any kind of work or like you said, you didn't make it through school. So, I mean, how did that work out? I mean, how did that work for you? I mean, if you had to support yourself or support, you know, I mean, life, how did you do that? How did you get through it?
Well, it's pretty hard. I take my medication seriously. I take it regularly. I don't miss. I know that's something that's common with people with bipolar is they'll feel fine and they'll still go off their medication for a while and then they'll have a crash. But I'm pretty regular with my medication. I know my brain needs it. It's very important to me to
Right.
function as best I can. I worked for myself for the majority of my adult life. So I just kind of had to push through or have somebody fill in for me. My mom would come over and help. My daughter helped a lot on days that I just couldn't do it. People around me stepped in to take my place.
Right. I brought up this thing on the computer here about bipolar and the lows to the depression side. So it says the symptoms of a depressive episode may include no interest in activities you once enjoyed, loss of energy, difficulty sleeping, either sleeping too much or not at all, changes in appetite, eating too much or eating too little, difficulty concentrating, remembering, or making decisions, and thoughts of death or suicide. So that sounds, I mean, exactly like what you were describing is, you had trouble just doing stuff, really. I mean,
Just
not even.
functioning, basic functioning was hard. Taking care of myself physically, taking a shower, getting dressed, brushing my teeth, just the things that are just so basic and everyday for everybody was a big chore for me. It's just so hard to do the basic things. And then, of course, the things that are a little bit more important don't get done either, like paying the bills or making phone calls and appointments, helping your children, doing laundry, doing the dishes, making dinner. None of that happened either.
Right.
So, I couldn't handle any of it.
So you said when you got out of college, where you got diagnosed with the bipolar disorder, and then at that point, they must have changed your medications and all that stuff, correct?
They did. They added quite a few. It's hard to remember what antidepressant I was on. I changed quite a bit of medication. So it's hard for me to remember exactly what was in place when. But they did add quite a few medications. And then they also added something for anxiety. I'm not sure what behavior led them to think that I had anxiety as well, but it makes me feel better. So I know I must have a problem with it.
So some of those medications, is something like you start feeling depressed and then you take it, and then 20 minutes later you start feeling better, something like that, or is it like an ongoing, like a chronic illness, something where you got to keep taking the medications to get in your system?
You take it daily. It usually takes 4 to 6 weeks, actually, for the medication to get in your system enough to feel a change. And that's really difficult when they're putting you on medication, is because it's kind of trial and error. It's different for everybody. Not one person with bipolar takes the same thing as somebody else, different dosage, different medications. And it takes several weeks to feel better. So you swallow these pills and hope for the best. And if you don't start feeling better in a few weeks, they switch you to another one, and then you start that cycle all over again.
And it's still that way, isn't it? I mean, even after all those years of studies and everything, I think bipolar, from what I've read and what I've been looking at, is it's really hard to diagnose. I mean, there's no test you can take, no blood test, no, you can't look at somebody and say, oh, they're bipolar, which, that word actually, gets thrown around, I think, way too much. If I hear a lot of, the guys, they got some crazy girlfriend or something, no pun intended, but, and they say, oh, she's bipolar,
Right.
or something like that. And let me explain something. I mean, having a mood change in the middle of a day or going through a mood swing in the middle of the day is not bipolar. And that's a big misconception. So I just think that people should pay attention to that. And so the people that are listening, if I hope you're getting some good information here.
It used to bother me when people would say that around me, not necessarily to me,
Right.
but just in general conversation, oh, she's bipolar or something like that. I was really sensitive to it when I was first diagnosed, thinking this is such a hard disease, and you're just telling people, that they have that.
Right.
It's such a sensitive thing to me, but it doesn't bother me anymore. I know that's just what people say, and I'm used to my diagnosis now. It's not a shock to me anymore. It was hard when they first labeled me as that. I didn't believe it. I didn't want to believe it. I didn't want to be labeled that. I knew that I had some crazy stories that went along with it, and people know the extremes because they end up in the news. And I wondered if that was going to be me, if I was going to, have severe enough episodes that I'd be in trouble with the law or, in trouble with my relationships or whatnot.
Well, I think either way it goes, a lot of people with bipolar disorder end up in the news or in some kind of a media, because if it's the manic side, they're doing something crazy, right? They're doing something just way out of the ordinary. Right. And if it's depression, it's suicide.
Right.
Or attempted suicide.
Right.
So, and I know a lot of people that have committed suicide, and who knows if they were diagnosed or if they had help or if they had a support system at home or anything like that. So what I wanted to ask you next, you mentioned you were married. So did your ex-husband, did he know that you were diagnosed with bipolar before you guys got married, or
no? And I don't know if he knows now. I don't know. I haven't told him that was I was going through a divorce when I was diagnosed. So I didn't share that with him. So I don't know if if he knows it's because of my children.
Right.
I haven't shared that with him.
So when you were with him, you were just depressed.
I just had the depression part.
And did he know that part of it?
He did.
Okay.
Yep.
And how did he deal with that?
I don't think that his family necessarily believes too much in mental health. I think it's more of a, can't you feel better? You can do this. Get out of bed, exercise. You'll feel better. Have some sunshine.
Like, let's get out and do something fun and you'll feel fine.
Right.
Okay.
So I don't know how much he really understood or sympathized with the fact that I just didn't feel good sometimes on a regular basis, and there wasn't anything I could do about it.
Right.
So he wasn't the best support. He wasn't horrible. He wasn't mean or degrading or anything, but he wasn't supportive as far as just the conversational support or the physical support, helping me out doing my chores or my errands or whatever. He wasn't really great with that part.
Do you think that if he knew more about what was going on with you, it would have been more helpful?
I do.
Do you?
I do. But I was at a point where I couldn't explain it either. hadn't done too much reading about it. It was just something that I had lived with for so many years that it was just part of me, and I didn't question it too much, because a lot of people have depression. That's not a really uncommon diagnosis.
Well, especially nowadays, there's a lot of, young people that I know, that are in the news that are depressed or have anxiety or on medications and stuff. I can't believe it's just so many that you hear about. And I never did when I was younger. I never heard about it really. There was some kids in school that kind of kept to themselves a lot, but you never heard about bipolar or depression or anything like that. And
I think that's just because the social media wasn't quite as big. I think that the amount of people that were still suffering was the same. I don't think a lot of them got the help that they needed, so that they didn't get the diagnosis. But I do believe that it's been around for a long time. I don't think it's a new disease that they're just labeling with people. I think that it has been around for a really long time. They just didn't probably get as much attention as people do now.
Right. And there is no cure for bipolar disorder at this point, right?
Right.
There's just treatments.
Right.
And they're just kind of trying whatever, basically, right?
Just to help you function.
That's too bad. And there's a lot of I was mentioning ECT, but we'll talk about that here in a minute. It has come a long way though since way back when people had depression or anxiety. When they put you in a mental hospital and strap you down and all that kind of crazy stuff to you, and it's come a long way. So at least they don't do that kind of stuff anymore. Right. I like lobotomies and experimental stuff. So do you think that with you having bipolar disorder, you think that is something that might have caused your divorce?
I
or
don't
part
know
of it?
if it was the cause, but it didn't help.
Right.
I don't blame anybody for my divorce except for myself. Um, but if I could have had a label on my behavior and gotten help sooner, I think things would have been easier. I don't know what the outcome would have been if it would have been any different, but it certainly would have been easier to deal with if I would have had some help.
Right. And now you said you had kids, so if you're on, these medications that I'm sure could do plenty of damage to a fetus. So you obviously had to get off the medications, right?
I didn't
While you
take
were
anything
pregnant?
while I was pregnant, no. And I did okay. Surprisingly, I did okay. I don't remember having too many bad times while I was pregnant. I didn't take anything while I was pregnant. I was really careful about that. Some people still do. There are medications now that are considered
They're safe.
safe while you're pregnant, and there's other alternative things like ECT that you can do that's safe while you're pregnant.
You could take you could do ECT while you're pregnant.
Yep, and that's one
Wow.
of the big draws to people that have depression or bipolar that are pregnant is that they can have ECT treatments
Right.
while they are depressed or while they are pregnant and not have any side effects for the
Right.
fetus.
Wow. So did your kids grow up knowing that mom was depressed and had bipolar depression, or?
I don't know if I had a actual conversation with them about that, but they know I would have bad days, and I would tell them I'm just having a really bad day today. I can't get out of bed. And they were older. It got worse. I had depression when I was first in college. I didn't really start having the bipolar complications until I was 30. So my children were already, older, not grown, but older
Right.
enough to take care of themselves for a while. I did do the basics. I fed them and they had clean clothes to wear to school. But as far as like interacting with them, I didn't do a whole lot. I just couldn't.
Yeah. And that's hard. And you didn't have a husband at that point either,
Right.
so it was just you.
Right.
So they kind of had to fend for themselves.
Yeah.
Yeah.
It makes me feel horrible.
Well, I mean, there's something, if there's something wrong, I mean, what are you gonna do? I'm sure you said you had some support from your parents and stuff like that, right?
I did.
So, I mean,
But I kept a lot of it to myself. I didn't want people to feel bad for me. And I certainly didn't want to look weak or sick. So
Right.
I did keep a lot of that to myself. Of course, my children knew because they could see me not functioning. But I didn't, I don't think that I told too many people that I was having a bad day. I didn't have a real big circle of friends at that point. So I don't think too many people really noticed.
so did you feel like just everybody was like judging you, or like, you'd go out and let's say to the grocery store, and you feel like people were like looking at you and judging you, or whatever?
No, I didn't. I stay pretty private. I don't tell very many people my issues or my diagnosis, or I'm very careful with who I share that with because I know there is so much stigma around it.
Right.
So I try to keep pretty private about that. If I tell them anything, it's just I'm having a bad day, or I tell them I'm physically sick and
Okay.
blame that on mentally sick.
Right. So at what point, what got you to go try ECT? That's what I want to talk about. I mean, you're on medications for years already. You know how it feels to be depressed, and they keep changing the medications, and they're already in your system and everything. So, what would make you want to try to do something completely out of the box?
Well, I had been told that I had treatment-resistant depression or treatment-resistant bipolar depression. So we had tried so many things,
What is
and
that?
so many things have failed. It's
Okay.
when they try several medications and different things to get you to feel better, to not be in such a depressive state, and they don't work.
So what would you, what percentage of your of say a year were you feeling depressed, would you say?
Right before I did ECT,
Mhm.
it was probably close to a year that I felt really crappy.
For the whole year you
For
were
the whole
depressed?
year. For the whole year. My life kind of fell apart. I was sitting on the couch and looking out the window for the majority of the time. I didn't go out anywhere. I didn't go shopping. I didn't have any hobbies. I didn't have any friends. I just stared at the tree that was in my yard.
Was your family getting like super worried about you and trying to get you to go see it, go do anything?
Well, I was seeing a doctor on a regular basis, and that's when I was trying different medications. But like I said, it takes so long for them to get in your system to see if they're going to work. So it takes a while to see that they're failing also.
Right. So was there a doctor available to you like 24/7 if you needed to call a doctor
absolutely.
and say, hey,
Yep.
And did you have those feelings of suicide?
I did.
What was that during that year?
It was.
And was that a daily thing? Was it a daily struggle to not kill yourself?
It was a daily struggle for a while.
So was it an actual, I'm going to do this, or was it just, was it a plan that you were gonna go through with, or was it just thoughts?
It must have just been thoughts. I did have an idea of what I would do. I didn't ever set a date or a deadline. One day I remember I was having a really bad day, and I thought, oh, this would probably be a good day to just disappear. And the kids were all at school, and I had some time, and I was really thinking more thoroughly on what I would do. And then I realized it was Thursday, and it was early release day, and the kids were going to be home any minute. And so...
So what did you think you were going to do?
I was going to take a handful of pills and get in a dumpster and get in a garbage bag.
Sorry. Yeah, that's sad.
Yeah.
Now, you got kids coming home and stuff. So were you thinking about what was going to happen to them, or your parents, or?
Well, I truly believed that I was a problem to everybody that I was around. So they would be better off if I wasn't there. It was just such a struggle to keep living. And I know I was a burden to my parents, to my children. And I just really felt deeply that everybody would be better off if I wasn't around. I'm just physically a burden. I'm financially a burden. I'm emotionally a burden. I was just a problem to everybody. I wasn't any good to my kids. I wasn't any good to my family.
Well, I sure am glad you stuck around, and I'm sure there's a lot of people that are.
Thanks.
By the way, this is my show, and I'm not supposed to be crying. No, that's really sad. Like I said, I've known. I have some friends that committed suicide, and it's a very sad thing. You get to know somebody, and you love them and care about them, and just to see them go through that depression and sadness is hard for everybody around them, including them.
I wouldn't say anybody even wants to die.
No.
There's just no other options.
Right.
They don't want to live, so what is the choice? What is the option?
So that was an ongoing thing for you? Like you thought about that often, or was it just that day?
No, often.
Okay, so and that must have been what led you to go ahead and try something new. And now, was it your doctor that said, hey, why don't we try this?
It was. I don't exactly remember talking to them about it, so they must have suggested it to me, and I didn't know that much about it either, and I didn't want to. I didn't want to scare myself out of doing it, so I didn't do a lot of research beforehand. I just kind of met with the doctors, did what they told me I needed to do in preparation, and to be honest with you, I did it because I was hoping I would die. I was hoping the treatment would kill me, and then that would relieve me of trying to kill myself. And it didn't. It made me better.
So I guess it was either one way or the other, right? I mean,
right.
You're either going to die or you're going to feel better, hopefully.
Right.
So, and you didn't think, hopefully it'll make me feel better.
No, that wasn't really the reason.
No. Oh. And it wasn't scary at all to go in there. And so tell me the process. Like, okay, so they said, this is what we're going to do. What was it? What was it like? What did you do?
Well, we meet with the doctor beforehand. I had to sign quite a bit of paperwork. They do a physical exam on you, making sure that you can handle the ECT treatments and making sure that you're sound enough to be able to tell them that, yes, this is what you want and nobody's forcing you into it. So I signed paperwork on camera. It was physically taped that was what I was wanting to do, and I understood the risks. And then I had to get taken off a couple of my medications because they're actually anti-seizure medications. So I had to, titrate down on those and get those out of my system because they would counteract with giving me a seizure.
Because the point of ECT is basically causing your body to go into a seizure, correct?
It's a grand mal seizure.
Grand mal seizure.
Yes.
And so what are their hopes with that? Like that it's going to like restart your brain or something, or?
Really, they say it resets it. It squeezes your brain so hard.
Just because of the stress?
The electricity causes such a strain on your body that it resets your brain and the functionings of your brain.
Okay. So is that a one-time thing? Like you go in and they shock your head and then you're good?
It's 3 times a week for about 4 weeks.
Wow.
So it's Monday, Wednesday, and Friday. And you go in when it's time. It's considered day surgery. So you're in the day surgery section. You can't have eaten since the night before. So you're starving. And then you're so nervous that you just feel so sick. I was nervous every single time. It makes me kind of anxious to think
what was
about
making
it.
you nervous? Because I mean, you said you just thought it was going to kill you. So I mean, what were you nervous about?
Well, I was still nervous to die. I knew I
Yeah.
wouldn't feel it if I died with ECT because I would be under anesthesia. But I was nervous for the side effects, the outcome. What would I be like when I came out of it? Would I recognize anybody? Would I still be the same? Would I have my same personality? Would I have forgotten major events in my life? I didn't know.
Now, I mean, I guess part of the can't even think. After they do ECT, part of the side effects is like memory loss and I mean, what else is there?
Well, that day is pretty severe that you have your treatment. My head hurt worse than I've ever had a headache in my life. Severe headaches. They'd give me medications through my IV and medications to take home to help with the headache. It was a horrible headache.
So it was outpatient. So you just went in for the day and then went home?
Right. We went in for the day. We'd leave. It was in Seattle, so I would leave fairly early in the morning and then check in and then sign some more paperwork and then take us to the pre-surgery, pre-op area and get an IV, get in a gown, get everything ready, like that part, getting ready for your treatment. And then you just wait. And
Right.
everybody is there at the same time, and they just do them in order of, I don't know what the order was, but I would just sit there in the room and just wait and wait and wait until it was my turn. And then they'd wheel me to the surgical area, put goop on the sides of my head, attach the electrodes. They put a cuff around, a blood pressure cuff around my left leg because that's the part that doesn't get the anesthesia, and they want to make sure you're having a severe seizure, so they watch your leg to see
Really?
the leg. And I remember waking up and having my calf sore, and I didn't know about that part.
Oh.
So I didn't understand how come my calf was sore.
Now you said we were talking before. You said you had an issue one of the times with the breathing thing. Like you were still awake when they started it or something.
They do. They give you 2 different medications. They give you something to paralyze your body so that you don't actually flop around on the table, and then they turn off your breathing. And so you're just laying there with no oxygen while that's happening. And when I had a different anesthesia one time, and he turned my breathing off before I was asleep. And it was extremely scary. I felt like I felt like I was going to die, like something had happened. There's been a mistake, and I couldn't tell anybody because I was out of breath. And the doctor said I said, I can't breathe with my last little breath. And he said, oh, give her some Versed, she'll be fine. And I remember the doctor saying that, and then I was under. And when I came out, that's what I remember. And I told him, something happened. This is what I remember. And he said, oh my gosh, you shouldn't have remembered any of that. And so every time up to that section, after that, I would want to meet with the anesthesiologist and explain what happened and make sure that he took a few extra seconds after he'd given me the medicine to go to sleep to turn off my breathing. That was the scariest part. And I think now that's why I have a lot of sleep problems, is because that falling asleep feeling makes me feel like I'm going to lose my breath, like I'm going to not be able to breathe. And so I take medication to help me fall asleep immediately so I don't have that drifting off to sleep feeling. because it panics me to feel that drifting off to sleep feeling. It makes me feel like I'm going to choke and die.
Right. Now, did you have like major headache after? I mean,
Horrible headache.
yeah.
Horrible headache. I'd have to go back and go to bed for several hours. I couldn't handle any sights, any smells, any sounds. My head physically hurt so bad. And I'd just go home and go to bed for a few hours. And then I had a few hours that I'd be awake and could eat something. And then I functioned okay the next day. But then by that next night, I couldn't eat again because I was prepping for the next day.
Oh, geez.
That part was a little bit tricky too.
So, but it was helping though. I mean, did you notice right away that it was helping, or
Probably
were you
probably 2 weeks in? I didn't notice much right away. I didn't have any sort of overnight comeback.
What was the the biggest difference that you felt?
I just slowly started to feel better. I remember slowly wearing better clothing to my appointments. I remember wearing my makeup again to my appointments, things that I just hadn't taken care of before. I was bathing more often. I was getting myself ready for the day, and then I was able to function on the days that I didn't have ECT a little bit better. At a time, it was gradual, but I do remember thinking, oh, I think I can get up today. Or,
right.
Oh, I think and I know it was because of the ECT, that because of the medication hasn't been helping. And so I know it was the ECT that made me feel better.
So you did that for 4 weeks?
For 4 weeks.
4 weeks. And after it was all over with, you felt better?
I did feel better. And they do it until you feel better. So they watch your progress, they ask you a lot of questions, and they make sure that you're feeling better before they stop doing it. And then you're supposed to have a treatment a month to do like maintenance ECT.
Okay.
So once a month you'd go back in and do that. And I did that for a couple of months, and then I felt better. I felt like I didn't have to do that anymore. I felt like I had got a handle on things, and I was functioning, and things went kind of back to normal.
So you were up off the couch, not
Right.
thinking about suicide anymore,
Right.
Taking care of the kids, going to work, just full on normal, happy-go-lucky you.
Right. I felt better.
Wow, that's pretty amazing. And does it work like that with everybody that they try it on, or is it like just a trial and error thing?
It's got a pretty good success rate. There are some people that don't have any response to it, and there are some people that have kind of a negative response, have the severe memory issues, complications. But I think I read it was 80% effective. Like
Really?
It has a pretty good success rate. And then I did after, I did my 12 sessions, and then I went back for a couple of maintenance sessions. And then the next year I felt kind of crappy again. I started to cycle down. It was about the same time frame. It was springtime. And I started to cycle down. And before I got completely to the bottom and felt completely worthless, they suggested doing ECT again. So I did another round of it.
Oh, so you did it twice?
I did it twice.
Okay. And it helped the second time also?
I did.
Okay. So you got through with both. And now, were you taking your medications again still?
Still, the whole time.
So you still take them?
Mm-hmm. Mm-hmm.
So if you're feeling better, I mean, why would you have to stay on the medications?
Because your brain still isn't making the chemicals that you need. So
like the serotonin, dopamine.
It's restarted it enough that you can feel like you can function, but your brain still needs the help of the medications every day to stay positive.
Okay, so now how long ago was all that?
Oh, gosh. 2006.
Oh, so it's been quite a long time. Yeah. And you're still feeling okay?
I have good days and bad days. I haven't had any
but
lows.
do you have a bad year?
No, I did not have a bad year. I did have, about 5 years ago, I did have a really rough time where I felt like I was kind of out of control, and I was feeling crappy often. And I had moved to Idaho, and I had looked into ECT treatments in Idaho and talked with my doctor about it. So I kind of thought maybe I would have another session of that. I didn't end up doing that, but that was kind of where I went because I wanted to feel better before I got really bad again.
Right, but apparently you started feeling better anyway, and things are okay.
Yeah, my insurance didn't cover it, so that's why the talk stopped with that. We just tried it, different medications. Still, my doctor was working with me. I'd go once a week to the doctor,
right?
And she was we were just working with medication.
And then you moved to Tennessee.
And then I moved.
And how did you feel about that?
About moving?
Yeah.
I didn't want to at all.
You didn't want to move.
Not at all.
And now that you're here?
It's all right.
And you're doing okay?
I'm doing okay.
That's good.
Yeah.
That's a lot to go through.
I've done really well the past 6 months. Before that, I was having a hard time functioning still for probably a couple of months. I wasn't doing a whole lot. I was staying in bed, not taking care of myself, letting the housework go. And I wondered what kind of help I needed, if I needed to get back to my doctor. I didn't have a psychiatrist at that point. I just had a regular family practice doctor, so I didn't know who I should go see. My current doctor is not, well-versed in psychiatry.
Right.
So I didn't, I went to her a couple of times and she upped a couple of my medications, but that was it. It wasn't a reoccurring treatment plan, a new plan. And then we moved just to a different home and I felt a lot better. The restart there, the nicer house, more sunlight. We got a couple more dogs, so I was more active with taking care of them. Gave me another reason to get out of bed.
Right.
And I have felt pretty good since then.
Does it feel like when there's something that you have to do, that you have to do and get up for, that there's a reason, like it helps to get out of bed and get you going, like get your blood moving and, does it help you feel better, do you think?
No.
No?
I really
Doesn't
don't
matter?
think so. It's so hard to get out of bed when I don't feel good that I just stay in bed.
Oh.
I get somebody else to take the dogs out. I don't let the dogs out for hours and hours and hours because I just physically can't do it. And I have tried to trick myself into feeling better. Like I will say, okay, if I can get up, I'm going to go shopping and I'll get to spend $35 or $50 or whatever. I would set that up to my head. Okay, I'm going to go shopping. I can get up and get dressed. And I thought once I got out of bed, got myself dressed, got myself moving, went shopping, that I would be able to continue on with my day. But not once has that worked. Not once was I able to trick myself into getting out of bed to feel better.
Now that you're feeling better and everything, you must have a pretty good support system and people who help you and all that stuff, yeah?
I do. And my children are older, so it's less guilt on that part too. And they understand quite a bit more. I'm able to talk with them more about what my situation is. And my family is really supportive.
Now, how do people help you? I mean, how do people help people that are feeling depressed with bipolar? I mean, what's their role? Because I know they want to help, or they think that, especially like spouses and stuff. Like, she's grumpy. It's my fault, maybe, or I don't know what her problem is, or I want to help her, or him, or whatever it may be. But how does someone go about helping?
Well, I'd say the number one thing is don't blame yourself. It's nothing that you can do to fix it. It's nothing that you did to cause it. So don't say, why are you depressed? Is it something that I did? Because it's not.
Right.
Ever. And there's no reason why they're depressed either. They can't give you a reason. It's not anything that happened. It's not anything that didn't happen. There's just no reason. It just happens because that's how your brain is functioning.
Right.
So to say those things like, can't you just get up and get ready? Can't you just get dressed? Can't you just feel better? Is really hard to hear, because if I could, I would be doing it.
Right.
So I think the best thing to do is just treat me like I've had the flu for a couple of days. Just help me out. Just be gentle and kind and let me, work through it. Either convince me to go to the doctor, call my doctor for me, or just let me work through it and have, several bad days and know that my body will cycle through that, and then I'll start to feel better again.
Gotcha. Now, how long has it been since you've had a suicidal thought?
Since ECT, since 2000.
Oh, so it's been a long time.
Yep.
So when you do get depressed now, it's just the feeling of no energy.
Right.
Not so sad and want to kill yourself, but more just blah.
Right. Just I'm having a bad day. I just can't physically do anything.
Well, I mean, it's good that you're not thinking about suicide and stuff like that anymore.
Right.
Well, that's great. Now, there's a lot of I've read a few studies on some trial things that they're kind of trying to work on, like ketamine. Have you heard of that?
I have.
Yeah, I read that, and the people they were testing it on, I mean, it was just almost like a miracle thing.
Right.
And it was like a one-time I think you had to go in for maintenance or something like that, and it was a certain amount that you'd have to take, but it was like boom, I feel
Overnight
great.
success.
Yeah, overnight.
Right.
And I hope that they get the studies and all that stuff done, and stuff like that kind of passes through the FDA or whatever it passed to pass through, because I think a lot of people sure could use that.
I would be in the study if they offered that to me.
I was going to ask you, if there was something else that they thought might help even more, would you still go and do something like that?
I would. And there's other things, less controversial than ECT that they can do. They can do magnetic therapy where they put strong magnets on the side of your head. There's other things like that they can do that I have looked into. I haven't done those because of insurance reasons. A lot of insurance doesn't cover that.
Right.
So cost-wise, it just hasn't been something that I can do, but I have read a lot about it.
No, I'm wondering if there's big side effects, like dangerous side effects of some kind of study like that, would you still be interested in doing it?
I would.
Really?
I would. Mm-hmm.
Not caring of the side effects?
Well, the ECT was the scariest thing I could think of to do, and I made it through that, and it made me feel better.
Right.
So I think that I would sign up. And not necessarily today, because I don't feel bad today. But ask me when I've been on the couch for a week if there's something I would try, and I'm pretty sure I would. Especially something like a medication like ketamine that they have already given to people, and they have already seen the success.
Yeah.
It's not like I would be the first person to take it. They do have a little bit of a guideline on what would happen and how it would happen. So I don't know if I would be the number one first person to try something new.
Right.
But I would be a part of a study if it was already ongoing.
Yeah, that'd be interesting to see how that works.
Yeah.
Yeah. And now, so you said it's hereditary. So do you think any of your kids are showing any signs of bipolar or depression or anything like that?
I do. One of my boys has been diagnosed with bipolar, and he struggles a lot. He has days where he doesn't do well. He has days where he does just fine, but he went through a good 2 years that was a daily struggle for him to survive.
Right.
Daily. He was in the hospital a couple of times because of a suicide attempt. So I feel really bad because I know he gets that through my side of the
Family.
DNA.
Yeah.
And he's taking medication and he's doing fine right now, but I never know if that's going to change either. So it's kind of difficult to keep myself in check and also watch him. And especially when I don't feel good, I need to remember that I still need to check on him to see if he's still functioning. Do
you think it helps, though, that you've already been through kind of all that it's a little more easy for you to talk to him about it and help him, know what he's feeling?
We've had quite a few serious conversations about it, mostly about the importance of taking your medication. He has been one that starts to feel better and then decides that he no longer needs medication, stops taking it, and then has a crash.
Right.
So telling him the importance of taking your medication every day has been something that we've talked about quite a few times. But I do think if you have somebody else that you can relate to, somehow it makes you feel better. Like the misery likes company. It just is something that it's easy to talk to because they already understand. You know how they're feeling because they're actually feeling it also.
Yeah. So he's more on the depression side of things too.
He has the depression side too. He does have some mania, but that presents itself as anger.
Right.
So he'll have spells where he's just not very nice.
Right.
Slam the door, yelling, being mean to the dogs.
Don't all teenagers do that though?
I can kind of predict when his is coming.
Right.
He'll stop taking his pills, and I can kind of see a personality change.
Right.
And he'll kind of gradually just get worse and worse and worse. And I'll ask him about his medication, and he'll have usually told me that he's not taking it right now. And then I know we're going to have a bad time.
Yeah. So have you thought about maybe the ECT for him? Or
I don't think he's severe enough for that. He hasn't had... maybe several years ago when he was about 16, he was having quite a few troubles. It was a really hard time for him, and I don't know if ECT would have helped him. I don't know if I would have suggested that. I didn't suggest it, so I don't know if I would really want him to go through it. It was so scary.
Yeah.
Scariest thing I've ever done. So scary.
Well, you got through it all right, and it looks like you're doing better.
Yeah.
I'm happy you're still around.
Thank you.
Is there any last things you can think of that you might want to tell people that are maybe interested in finding some treatment or maybe if they know someone that might have bipolar disorder, how they can maybe talk to them or help them or anything like that?
I would just suggest getting to a psychiatrist, not necessarily a psychologist, and certainly not a MD. They just don't have the background or the specialty in knowing all the signs of having bipolar or depression, and get help.
Right.
There's medication, there's therapy, there's extreme treatment plans. There's things that can be done. You don't have to be miserable.
Yeah.
There are ways to get help.
Well, you got quite a story, and I appreciate you coming on and talking with me about it. And I know you had a little bit of anxiety before you got on the camera or on here, but I'm glad you decided to, because I think you had a lot of good information for people, and I think people will enjoy listening to what you had to say. And so I want to let y'all know if you're on YouTube, I'm going to post some links down below for some resources or stuff like that. And for those of you that are just listening on the podcast platforms, well, I guess go find me on YouTube. But thanks again for listening. This is Shoot the Deuce, and I'm Stone Anderson. And can't wait for next week when we talk with the guy that's got the manic side of bipolar. He's got a pretty awesome story to tell, and I'm sure it'll be just as informative. So don't forget to subscribe, and we'll talk to you later.